Bismillahirrahmanirrahim and Assalamu alaikum. I am Dr. Huri Amir. Today we are going to learn about the terms what is referred pain, visceral pain. As up till now we know much about pain and what are the different neurotransmitters responsible for it, what are the different pain fibers which are taking this sensation of pain to the brain. Like we have the fast pain fibers, we have the slow pain fibers, what is the pathway, and we have the neospinothalamic, neospinothalamic, we have paleospinothalamic pathway, and this is how this whole process goes on. So today's lecture is about what is referred pain and what is visceral pain. Now what is referred pain is actually that when the pain from the viscera is felt at other region of the pain origin. When the pain from the viscera is felt at the region other than the location of that viscera, it is known as referred pain. Let's take the example of heart pain. You know that heart is over there in the center of the thorax, but if there is some sort of ischemia, most of the time it is felt on the left side of shoulder and on the left side of the left arm. So we can say that what is actually the origin? The origin is actually very much related to the embryology. Now what happened is this, that the viscera and referred pain areas, they are being supplied by the same spinal segment at the time of their origin. So that is how this whole process occurs. Now let's repeat it once more, that what is a referred pain? Well, referred pain is actually that type of a pain which is being felt in a part of the body that is fairly far away, or you can say remote from the tissue which is causing it. Or you can say that the pain which is felt in the area away from the tissue of origin is known as referred pain. For example, the pain in one of the visceral organs often refer to an area on the body surface, and I have already told you that one of the example is of that of the heart. You can say that the heart which is located over there in the center of the thorax, but if there is any sort of ischemia, any sort of insult to heart tissue, the pain is most of the time felt on the left side of the shoulder and left arm. Why? Because they have the same spinal segment origin. Now let's talk about the mechanism of referred pain, how this whole mechanism actually take place. You can see that the branches of visceral pain fibers in the spinal cord actually going to relay over there on the second order neuron in the segments, and they perceive the pain signals from the skin. Now when the visceral pain fibers are stimulated, the pain signals from the viscera are conducted through at least some of the same neurons which are conducting the pain signals from the skin as well. So the person has the feeling that the sensations, they are being originated over there in the skin itself. So we can say that the anterolateral pathway as well as the dorsomedial lemniscal pathway, they are actually helping one at the same time. Now what is the visceral pain? The pain you all know that whenever there is an insult, there is a discomfort, there is a damage to any tissue, organ, system of our body, this is actually going to be perceived by that person in the form of a pain. Now pain from the different viscera of the abdomen and chest is one of the few criteria that can be used for diagnosing the visceral inflammation, the visceral infections, diseases and other visceral ailments. Often the viscera have sensory receptors for no other modalities of sensations besides pain. And the visceral pain differs from the surface pain in several important aspects. So this is very important point to learn, that the viscera, they do not have the other sensory receptors. Like, you already have done a lot of receptors, but they are not there over there in the deep structures of your body, like heart, liver, spleen, kidneys, etc. What they do have are the pain receptors. Now, one of the most important differences between surface pain and visceral pain is that the surface pain is highly localized, whereas the visceral pain, which is highly localized types of damage to the viscera, rarely cause severe pain. For instance, a surgeon can cut the gut entirely in a patient who is awake without causing significant pain. Why? Because there is no sensory receptors present over there. So we can say that the surface pain is highly localized in comparison to the deeper structures. Conversely, any stimulus that causes diffuse stimulation of pain nerve endings throughout a viscus causes pain that can be severe. For instance, ischemia caused by occluding the blood supply to a large area of gut stimulates many diffuse fibers at the same time and can result in extreme pain. Now, what are the causes of true visceral pain? Any stimulus that excites pain nerve endings in diffuse areas of viscera can cause visceral pain. Most of the time, the visceral pain, as we already have done in the previous lecture, the visceral pain causes, they are most of the times the chemical insult, or you can say the chemical stimuli. But the mechanical as well as the other stimuli, they can cause the deep true visceral pain. So, chemical damage to the surfaces of viscera, spasm of smooth muscle of a hollow viscus, excessive distension of a hollow viscus, these all are different causes which can actually lead to the stretching of connective tissue surrounding or within the viscus and can lead to development of pain. Like if there is ischemia, there is accumulation of lactic acid, and that is actually the cause of, you can say, pain. Then if there is spasm, there is excessive contraction and there is no relaxation, which is ultimately going to lead to ischemia of that area. If there is excessive distension, it is going to lead to the stretching of the connective tissue, and ultimately it results in causing the severe pain. Essentially, all visceral pain which originates in thoracic and abdominal cavities is being transmitted through C type of fibers, which are responsible for taking the slow pain sensations. And always you remember that A delta fibers, they are responsible for carrying the sharp lancinating type of pain. So therefore can transmit only the chronic aching suffering pain of suffering type of pain. Now let's talk about ischemia, because this term is very important and it can lead to a lot of scenario based questions in your university exams. So you all are supposed to know about what is ischemia of heart, what is ischemia of brain, and what is this term angina pectoris, what is myocardial infarction, what is cerebrovascular accident, what is hemorrhagic stroke, what is hypertensive stroke, what is these all terms. So what is ischemia? Ischemia actually causes visceral pain in the same way that it does in other tissues. Why? This term is quite important. Why it is so important? Ask questions in your mind yourself why this whole process is so important. This is because there is ischemia is actually the term when there is ischemia is actually a term which leads to this idea that there is inadequacy of the blood supply to particular organ, tissue or system. So, ischemia causes visceral pain in the same way that it does in other tissues. How? Because there is formation of acidic metabolic end products of tissue degenerative products like bradykinin, proteolytic enzymes, and the others that stimulate the pain nerve endings. So, this is how the ischemia leads to the development of pain. Now, what is this term chemical stimuli? As we already have done quite so many times, I've told you that the chemical stimuli, they are actually responsible for the sensation of slow type of pain, which is aching, dull, slow to develop and slow to go. So you should be knowing about that if there is any damage to the viscera, like let's take the example of gut, the substances they're going to leak out into that of the peritoneal cavity. And you all know, like let's take the example of stomach. In stomach we have large amount of acidic juice, and what is that? That is gastric juice full of hydrochloric acid, and that is going to leak. If that is going to leak, and that is actually proteolytic, if it actually leaks through a sort of ulcer in stomach or duodenum, this juice is going to do the widespread digestion of the visceral peritoneum, and thus it is going to stimulate broad areas of pain fibers. And this type of pain is severe, it is excruciating, and it is very intense sort of pain. So all of you should have this idea and this picture in your mind that if there is some sort of scenario given to you, that there is a person who came to emergency with this feeling of intense type of pain, and he's sort of unconscious with that, he's not able to give you proper answers, he's in severe pain, and the relatives, they're giving the history that he or she is a chronic patient of gastric ulcer or so immediately you should have the idea that there is actually a sort of peritoneal cavity involvement. So one of the other types of pain can be due to the spasm of hollow viscus. Hollow viscus, what is that? Hollow viscus is actually that type of viscera which is having a potential space which can be filled, which can be distended. So a spasm of portion of a gut, or a spasm of a gallbladder, or bile duct, or a ureter, or any other hollow viscus can lead to this as a chronic type of pain. And also the mechanical stimulation of the pain nerve endings or the spasm might cause diminished blood flow to the muscle, combined with the muscle's increased metabolic needs, and